If you experience the frequent urge to pee, a burning sensation when you pee, and or a strange smelling pee, you just might have urinary tract infection. Hi love, welcome back to my channel. So today we're talking about urinary tract infection, and urinary tract infection is aptly named. It's just an infection of the urinary tract. If you don't know what a urinary tract is, it is the body's drainage system for removing urine. It consists of your kidney, 2 kidneys to your 2 ureters, and from there they connect to your bladder, and from your bladder to your urethra. Now the urethra is that small hole where pee, that's urine, comes out from. That is it. Any part of the urinary tract can be infected, but the most common type tends to be the infection of the bladder. Urinary tract infection, aka UTI, occurs when bacteria enters into the urethra and travels up to your bladder. Bacteria can also travel up to your kidneys, and this infection is way more critical. But in this video, we're going to focus on the common one, and that's the infection of the bladder. Now, how do you know if you have urinary tract infections? The symptoms of urinary tract infections include the consistent and strong urge to pee, like frequent urge to pee, like every time you just want to go and pee. And then the urge to pee is usually very strong, like stronger than usual. And then when you do go and pee, just a little comes out. Like it can be very, very frustrating. And even when that little comes out, you still have this sensation that your bladder, like there's still something, but it's not coming out. Like that is how you know you have urinary tract infection. That is like the most common symptom. Other symptoms include smelly pee, strong smelling urine that may or may not contain blood. Another symptom is this pain in your lower abdomen, like if feeling like a pelvic pain, like this, your lower abdomen. Also be in your lower back, pain in your lower abdomen and your lower back. That's how you know you have urinary tract infection. Another symptom which can be very embarrassing is urine leakage. That is when you're passing pee frequently, but it's just little amounts. When you have UTI, you have the tendency to like you have this urge strong, and if you don't have a toilet or whatever nearby, it is very, very hard to control it when you have UTI. Like I've seen cases of people that actually end up peeing on their body in public or right before they can even get to the toilet. Like it is very, very, very embarrassing. But the good thing is that you've come across this video, so if you're one that usually experiences UTI often, then just keep watching. I will tell you how to control this, how to treat this, and how to prevent this in the future. So in order for you to know how to prevent this, I have to tell you what causes it. Like what is it that you probably do that is causing you to have UTI or causing you to have UTI frequently. Now, the common causes that increase your risks of having a UTI include suppressed immune system. Like this is the cause of a lot of infections. That is when your body defense against bacteria, against infection is down. And this can be caused due to different things. That is, you're not eating well. It can be caused due to stress. It can be caused due to antibiotic abuse. When you're abusing antibiotics, you're using it too frequently, even when you're not supposed to. Another cause is sexual activity. When you're having frequent sexual intercourse or sexual intercourse with a new partner. Another cause is improper wiping method, which is a very common one that a lot of ladies are not quite conscious of. I mean, like when you go to the bathroom and you go and defecate or whatever, and then you're trying to wipe or wash with water or wipe with a toilet paper. Now, a lot of people just don't know what the right way is. The right way to wipe is by wiping from the front to the back. If you're wiping from the back to the front, you're introducing bacteria, because usually when you defecate, it is from the back door, if you know what I mean. That is the rectal region. So when you defecate and you're wiping from the back to the front, you're introducing bacteria from that place into your urethra or into your vagina also, because then you're going forward. When you're going backward, you're wiping from your urethra, your vagina, you're wiping to the anus, and you're wiping it off. Now, another one can be diabetes, which cannot be helped. If you have diabetes, you're probably prone to UTI more than anyone else. This video has been helpful so far. Please just quickly give it a thumbs up so that this video can be shown to other people that it will be beneficial to. Now to the part that we've all been waiting for, prevention. How do you prevent yourself from getting urinary tract infection? Now the number one I'm going to be talking about is hydration. Hydrate. Drink water, drink a lot of fluids. Drinking water has so many benefits. By hydrating, you're flushing out a lot of things in your system, and your drainage system will just help you to flush it out. And the urinary tract is part of your drainage system, so if you're drinking a lot of water and you tend to good urine, you urinate regularly the way you're supposed to, you're flushing out a lot of toxins, a lot of bacteria from your system. So yeah, hydrate. Another way to prevent UTI is to go to urinate as soon as you feel the urge. Whenever you feel the urge to urinate, try as much as possible not to hold it in. As soon as you feel the urge, just go to the toilet and urinate. Like I mentioned in the causes, a common cause of urinary tract infection or infections in general is when your immune system is down. And when you tend to abuse antibiotics, any little thing you just want to use antibiotics, even without prescription, you tend to be very prone to infections, and you're just basically just inviting bacteria to just come and infect you. So as much as possible, if you want to prevent infection, do not use antibiotics unless it has been prescribed by your doctor, by your pharmacist. Another common prevention that is often overlooked is that after any form of sexual intercourse, the first thing to do is to go and urinate immediately after sex. Make sure the first thing you do is to urinate. Even if you're going 2 rounds, 3 rounds, if you can, urinate in between those rounds just to flush out whatever it is that might have been introduced into your urinary tract. It's going to do you a whole world of good generally, and it's going to help you to just prevent infections as much as possible. Sometimes that is just the only thing that is even causing you to have infections. Some people use saliva as lubrication, which is a bad idea, by the way. Do not use saliva as lubrication, because the person's saliva, it might be yours, it might be your partner's, it can contain any form of bacteria, and when you introduce that into your vagina, it can cause a whole world of damage, a whole world of infection, especially when you don't now urinate after the whole process. Another thing you can do to prevent urinary tract infection is to make sure that when you go to the toilet to defecate, to urinate, you're wiping yourself from the front to the back, not the other way around. I don't know how to explain it, but I hope as I'm saying it, you're following. You're wiping from the front to the back, front to the back, front to the back. So just make sure you just try and get used to that as much as possible, and it will save you from a whole lot of infections. Another thing you can do to prevent yourself from having urinary tract infection often is to try to take supplements and probiotics. Supplements, immune boosters like high strength vitamin C. I think I will link some in the description box, and I'll put some on the screen so you know what I'm talking about. High strength vitamin C. There are some probiotics too. So if you're interested in buying, just go to my description box below and just click on the link there, and it will lead you straight to buying. They're quite affordable. Some are affordable, some are high. If you see that you're very prone to urinary tract infection, I advise you to just buy immune boosters, buy probiotics. If you're prone to yeast infection too, buy probiotics to prevent them. Even if you're not prone, they are usually good. When you take these things regularly, they just help your body to just regulate itself. If you're one of those that find out that you usually have frequent infections, especially UTI, some evidence suggests that you might find it helpful to use cranberry products like cranberry juice. There are even supplements. There are cranberry supplements that you can use, and like I said, I will help you to link some in the description box so that you can just go ahead and click and buy if you're in this category, and it will definitely be good for you. Okay, now let's move along to the treatment of UTI. The thing about UTI is that immediately you start treatment, it would the UTI might clear. You might begin to see that you're not experiencing those symptoms anymore. But like I said, make sure you finish your medication. The way to treat UTI and relieve the symptoms such as burning and frequent peeing and the smelling pee is antibiotics. But the drugs have to be used under the supervision of a doctor or a pharmacist. I actually need to go to a lab to carry out a test in order to know which antibiotic is going to work for you well, because there are so many antibiotics that can be used to treat UTI. Commonly recommended drugs for UTI treatment include nitrofurantoin, amoxicillin, augmentin, cefalexin, cotrimoxazole, that's Septrim or Bactrim, phosphomycin, and then levofloxacin or ciprofloxacin, but these are usually used for more complicated UTI. I know I'm just mentioning a bunch of words and I've put them on the screen for you to see the drugs that I'm talking about, but that's why it is better for you to go to a hospital or go to a pharmacy. Like I said, UTI usually clears within a few days, so it is better you just go through with your medication. Make sure you finish your medication to prevent reoccurrence. But at the end of the day, prevention is usually better than cure, so go back to the prevention I mentioned and try to boost your immune system, try to hydrate yourself, take a lot of fluid. Make sure when you go to the toilet you're wiping from the front to the back, not the other way around. Make sure after every sexual intercourse you're peeing, you're going to the toilet. That's the first thing you do after sex. You just go to the toilet and you pee. So if you are able to do all these things, you shouldn't have a lot of experience with UTI. Hopefully this video was very helpful for you. I have so many other videos coming up that are going to be just as informative, so make sure you stay tuned for that and turn on your notifications so that you will be the first to know when those videos drop. I have another video talking about yeast infection, how to prevent yeast infection and how to treat it. You can just click on the video right here. Go ahead, click on it so that you can watch it. I'll see you guys in my next video. Bye.